Good morning, everyone. We'll let everybody get on and we will get started. So good morning, good afternoon, and good evening, depending on where you are in the world today. As everyone is getting in, I will introduce myself. My name is Marcia Thompson. I'm a civil rights attorney and an assistant professor and chair at Aurora University, and also an SPI board member. I'm delighted that I'm going to be your moderator today on our web event, Evidence-Based Approaches to Building a Thriving America. Again, I'm going to give a few more seconds for people to pop in. And I know that folks are still coming. We see the numbers going and going and going. As we mentioned in our description of today, it's projected that our economy will grow. And that gives our cities and their leaders an opportunity to guide investments and policies that could enhance the quality of life across this country. Part of accomplishing that is start by empowering our leaders with timely, relevant, and granular data that reflects the unique needs and context of communities that we serve. Today, we're going to talk about using that data to identify gaps, cracks, and opportunities, using insights from the social progress map, and how our other leaders, our wonderful speakers from across the country, have used data in phenomenal ways to drive change and progress in their cities. We will also explore how data can help in your cities impact the social determinants of health and housing and workforce development. I'd like to thank in advance our panelists, our partner for this event, the National League of Cities, which is the oldest and largest organization representing U.S. municipal governments and dedicated to supporting cities to improve the quality of life for their residents. I'd like to extend a special welcome to many of its 2,700 member cities from across the United States that may have joined us today. At SBI, we share NLC's commitment to improving the quality of life for all people. As a nonprofit that creates data-driven tools and insights on how counties, cities, and neighborhoods are performing to inform and empower decision makers to drive equitable and inclusive progress. Again, thank you all for joining us today. And we are excited to share this group of experts' experiences using data and evidence to drive better policies and investments that will improve the quality of life in our communities and in your cities. So with that is a brief introduction of what we're going to do today. What I want to cover is a couple of housekeeping, just so everybody's on the same page. We are recording this call, and we'll share a copy of that with you and your colleagues. If you have questions, you can use the Q&A at the bottom of your screen in Zoom. We will try our best to address those questions throughout the presentation, but if for some reason we don't, we'll try our best to address them at the end. We understand that there's a lot going on in the world, but our intent today is to talk about how we use data to drive policy change and not have any debates around any political issues. In the interest of time, if you're interested in the extensive and illustrative bios of our wonderful speakers, they will be found on the registration page. And with that, if we are ready to go, it looks like we have a lot of people that have logged in. I am going to start with our first panelist, who is going to be Emmanuel. And if Emmanuel wants to come on, Emmanuel is an urban planner. He's an academic. He currently holds a lead role in Social Progress Imperative, tracking social progress performance in U.S. cities and neighborhoods. So welcome, Emmanuel.
Thank you, Marcia. Can you hear me?
Yeah, I can hear you and I can see you. Thank you for joining us.
Fantastic. Thank you, Marcia. And then hello, everyone. Thanks for joining us. The Social Progress Imperative has tracked the performance of 170 nations and on more than 70 or 50 unique measures of social progress for more than a decade now. And while almost every country, rich and poor, has seen a strong correlation between wealth and quality of life, this gap continues to widen for the United States. When we look at the data, We see that as a nation, we spend more on education, health, and safety than almost any other country. Yet the results of our investment rank us at a second or third-tier country at the best. For instance, the US ranks 47th in the world in child mortality and 70th in safety. Our education results are similar to Serbia and Slovakia, and satisfaction with housing in the US is on par with Colombia and Ghana. But there's also reasons to be optimistic. The US is #1 globally in the quality of our universities, fifth in the world when it comes to women with advanced degrees, and not surprisingly, #1 in mobile phone subscriptions. And most importantly, the US economy has emerged stronger from the COVID crisis and is projected to grow. For us as Social Progress, the message here is that as local leaders, we have choices on how we prioritize our resources to invest in different policies that will continue to drive prosperity and advance social progress in communities across the country. So how do we do that? Our mission at the Social Progress Imperative is to use data to talk about solutions beyond traditional GDP or other economic metrics. Economic indicators are necessary, but insufficient in telling us the full story of what's happening in our communities. Our work here focuses on providing indicators and composite indicators to capture the complexities of how public policy fail or succeed in providing solutions that work for everyone. Our data-driven tools support communities to tell their own stories and reimagine innovative solutions. We make this possible by ensuring that the data provided is timely, granular, and captures what is relevant to our communities. The data highlights the strengths and vulnerabilities of our communities and serves as a common language to discuss our shared experiences, fostering collaborative learning and data-driven policy solutions. For those of us who may not be familiar with our work, the DNA of our work is grounded in 3 philosophically driven but practical questions. Are we meeting the basic needs of all Americans? Do we have robust foundations to support the well-being of everyone? And are we providing and expanding opportunities for all Americans? These questions echo FDR's 1937 inaugural address, when he challenged us to test the progress of our society by determining whether we provide enough for everyone, especially those who have too little. We answer these questions and address FDR's challenge with data around more than 50 indicators. And it's very important for me to note here that in answering these questions based on the data, we keep seeing the same message over and over. GDP or income is not a destiny. The recipe for building thriving communities is more than, or it's supposed to be a holistic than we really typically measure with traditional economic metrics. So let's take, for instance, this graph of the 500 largest cities in the United States. And then we can take 2 cities with similar median household income, Champaign in Illinois and Miami Gardens in Florida. Despite they having similar median household incomes, one performs better than the other in terms of achieving improved social, health, and environmental outcomes for their residents. The question is why? Well, the answer we get from the data is that regardless of income, some cities are providing innovative policy solutions to lower housing costs and make their residents healthier and more educated. And today, some of our panelists will talk about how they've done this in their communities. We can also go deeper beyond the city level to see how success looks like at the neighborhood level. So let's take Chicago as an example. It ranks very high among the top 5 largest cities in the United States. Compared to the 4 cities, Chicago does a good job translating its economic gains into social, health, and environmental outcomes for its residents. But the story doesn't end here. So let's take, for instance, how we break down this composite index into sub-indices. And here we see that the story starts to get a bit more complicated and nuanced. We see significant disparities across neighborhoods in their performance across the sub-indices. We see these disparities between the highest and lowest performing neighborhoods, especially in health, education, and areas that support workforce development. And we can visualize these disparities in neighborhood performance. Again, we see a similar story. 2 neighborhoods may have similar median household income, but perform differently in terms of how well they are translating their economic fortunes into meaningful and improved social, health, and environmental outcomes for their residents. In fact, rich neighborhoods sometimes perform poorly than their poor counterpart. The policy goal is to use data or evidence to target the intersection of factors for thriving communities. And for us at the SPI, when we look at the data across cities, we observe similar intersection of factors that remain key to policy solutions in building thriving communities. It's about ensuring adequate housing for your resident, making sure that your residents are healthy, and then also supporting talented workforce. These factors are interrelated and requires precision public policy driven by data or evidence. It requires using the data or evidence to target drivers or factors that can generate cascading and multiply effect across other factors or drivers of success. Data or evidence-driven public policy is how we leverage our economic fortunes or misfortunes to transform our communities into thriving, healthier, safer, and resilient communities. Marcia, that is my end.
Thank you, Emmanuel. Thank you for sharing, and thank you for highlighting my city. Next, we have Katie. Katie is the founder. Katie founded Advance OC, a nonprofit in Orange County, California, if you don't know, to address inequities across its community. Welcome, Katie. I've got a question for you. The first question I have is, you've collaborated with county health departments to map out social progress at the neighborhood level. Emmanuel just talked about the granular level of some of the data. At the neighborhood level, you've pinpointed areas of need and opportunity. Can you describe the tool that you use and how it's being used?
Sure, happy to. Thank you for that context, Emmanuel. That was really wonderful. When we looked at the needs of Orange County can be viewed as an area of great wealth. We do have many cities that have a high median household income and large estates, in our county. But we also have very poor areas and areas of very vulnerable communities. And oftentimes when we look at county level data, those communities become invisible. And it's very important for those of us who are working in the equity space, especially to try and close health disparities and health outcomes here in Orange County, that we look at a much more granular level. And that's when we started applying the Social Progress Index and the 55 plus indicators that we have for Orange County to our equity map. And so we created this layered map with SPI at its foundation, then demographics that is populated by the US Census Bureau, and then population health data that's populated by the CDC. When we look at those three things, intersectionally, we can get a better picture of the vulnerabilities from a racial and ethnic standpoint, from a age standpoint, from a gender lens, as well as from a health lens and socioeconomic indicators as well. So during the pandemic, we partnered with the Orange County Healthcare Agency to be able to create a vulnerability index for COVID. And using comorbidity risk factors such as underlying, health conditions like cancer prevalence, asthma, and then social determinants like housing overcrowding and things like that, we were able to then really finesse a very, very accurate picture of the vulnerabilities of each neighborhood, each of our 613 neighborhoods in Orange County to COVID. And with that tool, we were able to then to identify a strategy for the county to go and pinpoint the exact locations where the county should, put up vaccine pods. And that was in the early days when we were trying to make sure that the vaccines were equitably distributed and given to the people with the highest need, right? And so having done that and having used that as a proof of concept, we are proud to say that we've been able to apply the same theory of change to many other disciplines, including mental health, mental and behavioral health, as well as social justice, access to justice. We're doing a social determinants of justice map, as well as a child vulnerability index. And then in the future, we hope to continue to advance our work in population health by partnering with organizations who are pursuing precision medicine.
Wow. Well, Katie, Orange County is doing some things. Thank you so much. Next, I have up Coreata, and Coreata serves as the Senior Deputy Director with the City of Birmingham's Department of Innovation and Economic Opportunity, and he is responsible for driving the mayor's vision for a more resilient and inclusive economy. Thank you for joining me, Coreata. I've got a question for you. Are you ready for my question?
Yes.
All right, here we go. Can you tell us more about this vision and the work towards achieving it with the mayor and what you do in your innovation space?
Absolutely. And I think, one, thanks everybody for being here. It's a great opportunity. But particularly to our recompete application that we were recently awarded from the federal government. Our vision for Birmingham is a city where opportunity isn't determined by zip codes or background, right? Most people know about Birmingham, Alabama, and its sort of storied history. And so it's a city where every resident, reflecting our diverse population, but it also includes a very unique population of African Americans as well. And so with that, when we talk about good jobs and we talk about thriving businesses and supporting communities, some of those are very hyper focused on African Americans in particular, because the city is over 70% Black. And so we want to lift that up in a way that doesn't exclude any other communities in Birmingham, but those that are most our vulnerable populations are able to get the resources that they need. And so our particular North Star when it comes to recompete is really around lowering barriers, trying to dismantle those barriers that keep people from obtaining, accessing those good jobs that we are also recruiting as we look at economic development. And so what you see here on the screen is a map of our plan. It has sort of 4 pillars to it. And we're doing this hub and spoke model. So we'll have a central location, but we'll also have these sort of spokes throughout the community and footprint so that it's accessible to everybody. So we're not looking at just making a centralized location where only, a couple of people can get to, but we're bringing this to the communities, to the libraries, to the rec centers, so that folks can actually get to these training centers. They can access these jobs. They have access to quality childcare and transportation so that they can not only, again, get these jobs, but keep them as well and continue to grow. And so this isn't just a plan for us, it's a commitment. So we're using data to track our progress. We're continuously improving what that plan looks like based on the data. And then we're working tirelessly to make sure that we have equitable outcomes for everybody in the city of Birmingham.
Oh, thank you so much, Coreata.
Yeah.
Next, I have a question for Lydia. Lydia leads Deloitte's housing and homelessness offerings for the United States. Lydia?
Ready for my question.
All right. So you work closely with state, and city governments.
Mhm.
And that gives you a unique national and local perspective on the challenges facing communities across the country. What do you see as the primary drivers for our housing crisis in the United States?
I get the easy question.
I know, I was gonna say, it was a big question. It's just a little small question.
Yeah, housing is a complex issue. I'm going to list off several primary drivers that we're seeing that's causing the housing shortage. I mean, first of all, there's a simple supply and demand imbalance. The U.S. population continues to grow, increasing the demand for housing. We think, looking at the studies, there's anywhere between 7 to 9 million homes or units short of what we need. There's different dynamics of households. There's more single person households and smaller family units, increasing demands. There's an aging population. Aging seniors require different types of living places that are short in supply. So that's one, is like there's just a supply and demand. We have not built enough units. It's been a long time sort of underinvestment in the number of units that we need. We all have seen the mortgage rates increase and the materials cost in construction. So just overall costs in housing have gone up. The most recent data shows that more than 50% of renters and more than 30% of families are house cost burden, which means that they are spending more than 30% of their income on housing. And so, it's taken a big chunk out of people's paychecks just to stay housed. There's always zoning and land use regulations that sort of challenge the supply that's needed. The climate issues have also not helped. Seeing our friends in North Carolina and in California, where we're like decreasing the supply, so the climate challenges are even making it harder. Those are just a few of the challenges. We have seen an increase in the number of homelessness. In last year's point in time count, that's a count that HUD does nationally, there were over 770,000 folks experiencing either sheltered or unsheltered homelessness. And worst of all, 1 in 5 of those folks experiencing homelessness were children under the age of 18, which there's all sorts of data that shows, kids who experience a homelessness are less likely to graduate high school, are more likely to be involved in the criminal justice system. Just the stability, Maslow's hierarchy of needs, you need stable shelter to sort of execute on lots of things. And so the data is not great right now in terms of where we are with housing and what we need to be doing.
Wow. Well, thank you for that. I'm going to come back to you because I've got another follow-up on that one. But let me get to one of our other panelists and I'll come back to you. So next panelist is Laura. And Laura is the Chief Resilience Officer for the City of San Antonio and previously worked in Austin and Houston, focused on developing citywide efforts to help communities prepare for and bounce back from types of shocks and stresses. So Laura, I've got a question for you. So a lot of the things that our panelists have talked about all encompass some of the things that is in your introduction, but social progress data reveals significant disparities between neighborhoods in nearly every city across the country, particularly those affecting most vulnerable communities. What strategies have you seen succeed in reducing these inequities and reinforcing sustainability?
Yeah, thanks, Marcia. Well, we're only resilient as our most vulnerable. And so to build resilience and to be truly sustainable, we must focus on the individuals that are carrying the heaviest burden in our city. And those groups are limited in their ability to address the challenges they face and are further set back by disasters, either due to a lack of options and choices, lack of access, or simply a lack of understanding from implementers of what policies, projects, programs will be impactful and transformational for generations. So I have 3 examples that I wanted to highlight today. First is that they're not created in silos. And they're not created in silos by experts. Rather, they're co-created with individuals that are and will be impacted. So in one city that I worked in Austin, we were looking at implementing resilience hubs. And the importance of the community advisory committee that was set up helped define the purpose and the mission of the program and the type of services that were needed, the locations, and ultimately that community group helped leverage the community organizations and resources and expertise to create a stronger network of service providers. But in that process, we use an equity assessment tool to help guide us through the design of the program and ensure it met the equity goals and objectives. And so it allowed the program to be accepted and be supported right from the beginning, while ensuring that resilience hubs were a trusted space for the community members. Another strategy that we worked in when solutions are thoughtfully implemented and measured from the beginning. And often, we move fast as cities to really try to obtain quick wins. However, we do take the time to thoughtfully implement a strategy, develop metrics, and scale it, and measure them. It actually leads to transformation. So in San Antonio, we utilize our Equity Atlas to measure and track the progress of all of our annual budget initiatives with respect to achieving equity outcomes. And it's become a national best practice, which leads me to my third point, which is that impactful strategies are institutionalized as a best practice and are focused on the process itself. And so another example that I can think of that comes to mind is when my work in Houston, when we embedded green stormwater infrastructure within the capital improvement planning process and within traditional infrastructure projects. We knew that green infrastructure could provide a wide array of benefits, from ecosystem services to improving quality of life and health outcomes. And so the approach was to create an interdepartmental team with key community members, but also it allowed us to develop metrics that supported our claim. And so by focusing on that specific part of the program, green stormwater infrastructure first, rather the entire CIP program, it allowed the team to have more flexibility to demonstrate the benefits of the proposed process. So we use data across that process, specifically our Equity Atlas in Houston, to demonstrate the impacts of the intervention, which continues to be tracked and actually went beyond green stormwater infrastructures and now is looking at all of the CIP projects. So the most important thing to consider is that really these impactful strategies are people-centered and are focused on the benefit to the individual by really honing in and focusing on the impact of health and quality of life as a key metric in the final outcome.
Thank you so much. We've got one more panelist to introduce our audience to, and that is Zach. Zach is the Vice President and Local Practice Lead for Results for America, which helps governments use the power of evidence to advance economic mobility. Zach, welcome. I've got a question for you. All right, Zach, here it goes. What are the biggest barriers for local governments in using data and evidence effectively in policymaking, and how can this barrier or that biggest barrier be overcome?
Thank you. I feel like Lydia here, the small questions getting asked our way. So really, what a pleasure it is to be here with Social Progress and NLC. As you mentioned, our mission at Results for America is to make investing in what works the new normal, so that government decision makers really have can effectively and efficiently use evidence and data to impact the over $2 trillion a year that government spends at the federal, state, and local level to open opportunities and advance economic mobility. And I think to what my colleagues on this panel have said, data and evidence are really key tools that governments can use to scale proven policy solutions and institutionalize decision-making through budgeting and procurement practices that really can translate into real results. Now, as you said, actually at the beginning, that budgets may be growing nationally. I'm sure many folks on this call right now either currently or just came out of budget processes where government leaders were working with shrinking budgets, right, with increased scrutiny on what it is that you're looking to invest in. And we at RFA are working aggressively with, I think, many folks here and are thinking with you about, how do we fund what is shown to work especially in these tighter budget climates, to deliver stronger economic outcomes for all of your residents. And so to directly your questions, I'm hearing kind of 5 big things that are in buckets that are kind of the biggest barriers. Capacity, resources and funding, culture, know-how, and then kind of examples and peers. So on capacity, I think this is no surprise. Every local leader is strapped for time. And the benefits of grounding decision making in evidence and data are really clear. Actually facilitating that process of transitioning to that kind of a model can oftentimes require or feel like it requires more capacity than you may kind of have at the time. And the same thing goes with the second problem, resources and funding, right? One community we're working with was facing 6% cuts last year, and now we're facing 6% across the board cuts this next year. But when it comes to the sort of broader model, what does it look like to actually know, and you're facing these challenges by defining and listing what budget items or service providers are using a model that has shown to be effective in delivering the outcomes you're really trying to achieve? So you're not just cutting what works or cutting across the board, but you're being smarter about what the effort looks like. So you go from an unknown distribution of funding to something that you know what that looks like, and you can make smarter decisions as an organization, as a whole enterprise. And we have partnered at Results America with local governments to make facilitating that process easier. And we have this shifting dollars technical assistance that we've been providing to many folks out there that aligns with what does it look like to bring data, procurement, and services practices into that. The third thing I mentioned was culture, and creating a culture of evidence-based decision-making is really hard work, and it requires, and sometimes going against the grain and effectively managing a shift for stakeholders. Inertia is hard. And although our residents all really care about results, there's not a natural constituency for kind of prioritizing evidence and budgeting, for example. So I think through a lot of this work, there's so many good resources out there to kind of help support this. The What Works Cities initiative for those cities on this call helps to baseline your data. You can go to whatworkscities.org, take a look at that, how you stack up against others to really get a basic sense of this. And that helps to sort of build the practice forward through then building that culture for the next 2 challenges, which are kind of know-how and examples. And I'll just quickly go through this. The combination of a kind of a lack of know-how and a capacity constraint can be really hard. But luckily, there's a ton of resources out there about what does it look like to incentivize, prioritize evidence and data into decision making. So sometimes it's, I don't know, I have a challenge, my mayor is telling me I need to solve housing, Lydia, so like your point, like fix it immediately, right? That's not easy to do in a 24-hour, 40-hour period, but there is great evidence of what works out there in the space and many good clearinghouses out there. Results America runs an economic mobility catalog that was created exactly to do this, to help local government leaders identify and implement evidence-based strategies to advance economic mobility in your communities. And it contains a summary of over 50 high-level strategies, nearly 200 specific practices. I highly recommend you go into that. Part of that is evaluating whether or not your programs are working. You're going to pilot something useful. We have an evaluation policy guide that's out there that is really helpful in helping to stand up what a evaluation policy could look like that aligns the dollars you're trying to do to not only make sure you're doing something well now, but you're testing it so that you can spread that practice going from pilot into something that's much more systemic, that when you're investing your general operating support into it, it can be done with a know-how that you're doing, you're a good you're being fiscally responsible about the taxpayer dollars in this. And the last thing about examples and peers, like we all want to know what our neighbors are doing. None of us wants to be first through the door on testing something out, but we do want to be sure that what we're doing is based in the best knowledge practice as possible. And so many membership organizations like NLC, NACO, GFOA are incredible at putting out resources, at connecting about what has worked in your neighbors. I would encourage at Results America, we run a set of solutions sprints that help collaborate with your colleagues across the country in executing evidence-based practices. And we have one coming up on accessing ability to pay and fines and fees that can collaborate with you and other colleagues across the country that execute this work. And then last, oftentimes the solution to the challenge you're looking for, or how to build out that evidence practice, that data practice in your government, is not across the hall, it's across the country. And you may be an island to the one person who's doing this work within a city or a county or a school district. And so we're really clever, or really trying to ensure that folks across the country are able to meet. And we're opening up a new results network, which you can sort of pilot. It's opening up its pilot period next month. We'll drop the sign off in the chat. I would encourage many of you to join if you're really interested in thinking about how data and evidence can play a major and core role in advancing economic mobility in your communities.
Wonderful. Thank you so much, Zach. And just a pause before I go back, because I've got some other questions for our panelists. If anyone wants to throw a question in the Q&A, don't forget, our folks behind the scenes are collecting those, and hopefully we'll get to some of your specific questions for our panelists. But I'm going to round back up to Katie, because some of the stuff that Zach said and Laura said and Coreata said and Lydia said all come back to how do we get this information to the people who need it? And I think Zach just really talked about those barriers and those challenges to using evidence and data in our policy decisions. And one was culture. I like that, as because we know you got to get people used to this. But Katie, how do we actually get these data tools and make them accessible? Not even the culture, but how do we get them accessible to community-based organizations, our decision makers, and then regular folks on the ground that actually want to use this information? And after this webinar, we're hoping they're all going to be slamming on our sites. But how do we actually get this to them so they know they can use it and access it?
That's such a great question, because ultimately the goal of all of this is for us to create a catalyst for action, right? If we're just admiring the problem, then we would put up a map or a dashboard and just admire it from afar, right? And make it as complicated and not user-friendly as possible. But the goal here is really to actually distill all of that very complex information into little bites that people can digest. And so for Advanced OC, what we have done is to match the data with a address lookup tool. So every single person in Orange County can type in their address, and it connects them to the scorecard for their neighborhood, showcasing all of these 55 indicators of the SPI, as well as all of the other indicators that we have gathered for them. So we are trying to make it super easy for them to have all the information at their fingertips. And our hope in doing that is that they can print it out and either bring it to data office hours with us, or if they know and they have an understanding of what the data is showing, then they can take it to their local elected leaders, right? And talk about kind of the issues at the ground level. So we always want to be able to get the data and put it into the advocate's hands, right? Just putting it kind of on a pedestal doesn't really drive change. Another thing I would say is, in the world of data, we try to make things look very good, but it's super complicated and never really explained. And so one of the things that we try to do on our tool is we have a more information button. So you click on that and at any indicator, and it tells you what is the definition of this data stream. What is it trying to capture? Why is it important to know about this data and to track this data? So those types of tools and user-friendly tips, I would say, is really critical, right, for anyone who is trying to adopt a data solution for their city.
Wonderful, thank you. I'm going to tap onto that momentum there and pop over to Laura real quick. Laura, if you're just, after this webinar, people are just chomping at the bit to build a data-driven equity framework for sustainability, or any of the other things that we talked about. Where can they start?
Yeah, I mean, I can tell you every city looks completely different, and that there is no specific one standard approach. Every city is starting from a different place and serves a different community. So that is the first step, really, is getting to know and evaluating what is important to your city and your community. I would start by first evaluating what you're currently doing that is advancing equity and sustainability and resilience. The initiatives and efforts that can be cataloged so that as a city you can understand where you're starting from and what is that baseline. And then from there, you can conduct a gap analysis, essentially looking at best practices out there. There are many cities that have gone through this process and are going through and setting up programs where data has been utilized to understand these gaps. So look at what other cities have done. You don't need to recreate the wheel. but rather rework it to be able to navigate the terrain that you're on. And then from this, validate this data and information with communities that are impacted. I once heard that there's no stories without data, but there's no data without stories. And I've always kept this in mind. The lived experiences are the most valuable to help shape the strategies and the interventions that we need. And so spending time capturing that critical piece of information through different means, right? You can assemble community groups, individually interview people, focus on the most vulnerable neighborhoods, and build those personal relationships. Once you get to understand what drives individuals, then you can identify the key steps that are needed to achieve those health and sustainability and equity outcomes that have been defined. And then I'd finally say that throughout this process, keep in mind the final outcomes and how you will measure them, right? I spoke about how different tools, the equity atlas, equity assessment tools can be utilized in this process, but also think about the metrics that can be established along the way, because these are ultimately what drives decisions and policymakers. And so gathering that evidence and measuring the impact so that you can bring others on board for this change.
Wonderful, thank you. So Coreata, that was like a serious like bunt to you. So because you showed us that wonderful 4-pronged approach. So how are you using data to support the design of what you're doing in Birmingham in your Recompete project? And can you explore a little more about that?
Yeah, absolutely. I mean, that we started with data. If you look at our narratives, you would probably think a data scientist wrote it, because there is data all throughout, because we wanted to set the bar to say, here's what the data states. Forget where we're trying to go. Here's our baseline. And so that is something that became really important for us, particularly to Laura's point, in Birmingham in particular. When you think about communities of color, particularly in Birmingham, you think about where the starting point is. And for us, with civil rights, all of that happening here, sometimes social trust is like the barrier that we have to get over, right? And so in order to do that, we have to demystify the data. What does it really mean? What was the impact? We have to be very honest and transparent about what those impacts were, both on the social injustice side, but environmental justice as well. And so, you know, we were a little nervous at first to put the narrative together because it included so many data points, but we went forward because we wanted people to know where we were starting. And we wanted to paint a clear picture of where we were going and how we got there. And so those 4-pronged approaches that you see there is like workforce training center is one of them. Well, what does that really mean, right? Uniquely for us, we sit in economic development. And so our workforce and talent development, our small business, real estate management, sports and entertainment, data, all of that happens in one department. And so when you think about workforce, there's many definitions to that. But for us, to our residents, what does that mean? We want you to be able to get quality jobs. And then with my left hand, I'm also in economic development, recruiting businesses in. Well, what does that look like? What does $1 million incentive really mean to a resident? Well, that we have to demystify that. And so what it means and what we've tried to show is that $1 million incentive, and I'm making up a number there, means that they need to recruit from Birmingham, right? And city of Birmingham proper, not the MSA, not the region, but from Birmingham. Well, if we're putting that demand on a company to recruit from Birmingham, are you ready for that job? Can you access that job? Can you get there with transportation? All of that then becomes a part of it. One of our biggest barriers in Birmingham is that we have the second largest number of single parent households. No surprise to anybody here, I'm sure that 65% of those are women-led households. And so women being caregivers, now childcare becomes an issue, because if we really want to make this workforce inclusive, how do we make sure everybody, but particularly for us who is most vulnerable, women are entering the workforce? So we need quality childcare. Every childcare center in our city has a waiting list, and I'm sure in everybody else's city they do as well. Why is that? You know, and every one of them operate at a deficit every single year. But the question is, why does that happen? And so what we're planning to do with the data that we have is say, we need a workforce training center of excellence. We also need a childcare training center of excellence to track mobility. And so the city will be subsidizing a piece and portions of childcare every month at this particular center, which, by the way, is layered over another grant that we have, which is Choice Neighborhood. So we're layering multiple pieces of investment into Birmingham to really track the mobility. And so with the incentive that we'll use to subsidize, we want to be able to track for those parents who are in these childcare facilities, what does mobility look like if you're able to subsidize childcare? If you're now able to get to these jobs and there's fixed routes within your communities that you're not having to have someone drop you off like downtown for us and then go to the jobs. If there's a bus route or a micro transit route that is close to your where you live, like what does that do for your economic mobility? And the other part of our application, there's a business center of excellence. So all around inclusive growth around small businesses. What we do know is in the United States, 99% of all activity is small business activity, right? And so I think sometimes we forget that is the driving force to communities. When you want Boy Scouts, when you need, school supplies and you need, cliques for a local, sports team, it's typically a small business who's writing that check. How do we make sure that those small businesses are growing and they're not just one employer or like sole proprietorship, but they're employer firms? And so not only are they giving back to the community, but they're also providing jobs as well. And so this center will look at our small businesses, particularly in the construction and transportation sort of infrastructure area, and say, we have a large number of businesses who are sole proprietors in Birmingham, but they're not employing anyone, right? Like they're contracting the work out, which we appreciate, but how do we flip those into employer firms so that we have the long-term sustainable growth within the community? And so we're going to wrap all 4 of those into one plan for the next 5 years to really track what economic mobility looks like for our most vulnerable population, but in particular, when we think about women and people of color in Birmingham who have historically been excluded through multiple ways, right? Some of our neighborhoods in this particular footprint, the streets are too small for a city bus to go down. So we need to do a fixed micro transit route, right? They can't access the libraries because it's too far away. And so we start to look at all of that and say, out of these residents, and prime age employment gap is what we're talking about, particularly here, which is the ages 25 to 54. This footprint had the highest number of prime age employment gap. And when you think about the generational impact of that, this area is also very booming in the steel industry. And so that generational impact, when the steel industry left Birmingham, it left over 25,000 residents in Birmingham without jobs or a way to even get to other jobs in the city. And so these communities have insulated themselves, some intentionally by policy, but it's sort of insulated itself and not been able to really access the overall economic goal of Birmingham. And so what we're doing is taking a very unique approach to say, yes, we can recruit jobs. Yes, we can get businesses into Birmingham, but who's going to access those? Are Birmingham residents who are paying their tax dollars to us as government officials? Are we doing the right thing by making sure that they not only know that these jobs are available, but we're training them for these jobs, they're obtaining these jobs, and hopefully they're growing within these jobs and make generational impact. So that's how we're using data to start where we are here. And 5 years later, we hope that these data and data points and sets look completely different, and there's upward mobility for everyone, but definitely for those who are most vulnerable.
Wonderful. Thank you so much. And that, again, Lydia, I want to tag you in on that one. Some of the stuff that Coreata talked about definitely impacts the area that you work in, which is the underhoused or unhoused population. What are you doing to use data to address some of those fallout issues from some of the things that everybody's talked about, which is, economic mobility, but also housing and, having sustainable housing and having housing in general? What are some things that you use for data points for that?
Yeah, one of the things that's happening in housing and those working to address homelessness, there's a phrase called functional zero that many folks, and probably Coreata's nodding his head, that communities are seeking to have functional zero homelessness, which means when somebody presents themselves as homeless, that they have a place for them to go. And I'm going to give a shout out to Community Solutions. They're a nonprofit that has been working. They may be working with a lot of communities communities on this call. And the heart of that is we have to have the data and we have to know by name who is homeless, so that and what their needs are, so that we can get them the right services. The HUD does, the stats I threw out are from HUD doing a survey once a year and at night in January to try to figure out who's homeless. But the way that communities, I'm going to give a shout out to Houston. I know that it's easier to address housing issues when you don't have zoning, right? That's like, oh, don't bring up Houston because that's easy when you don't have zoning to like figure out housing solutions. But what Houston did really, really well is getting all of their stakeholders, Harris County, City of Houston, their continuum of care, to the table, and from a data perspective said, who are we serving and who needs what kind of bed, and how do we do that bed matching better from a data perspective? And that is as much the reason that they've been able to drive down their numbers around homelessness, getting organized collectively as a community and decide, here's how we're going to collect the data, here's how we're going to share the data, and here's how we're going to address the problem, I think is beneficial for any cities here.
Wonderful. One last question to Zach, and then I'm going to wrap it around you all. So got some questions, so get ready for them. Zach, Lydia just gave a very specific example of what they did in Houston. Are there specific strategies that you know are effective, that have evidence-based for economic mobility?
Thank you. It's a great question. I want to just build up something that Laura said earlier about really understanding what you're doing, right? And it's a great place to kind of start. And Coreata says sort of starting from the basics, like demystify this. I think these are really important concepts. What we sort of say when we want to think about advancing the use of evidence to address economic mobility, the first thing we want to start with is like, what do we mean by evidence? Like, are really establishing a definition for what it is that we're trying to say is important. And that allows us to say, this is what evidence-based means, this is what evidence building is. Because once we have that definition, once we align on the basics, on the idea of what it is we're trying to do and what works in our community to advance the practices and that kind of baseline that we're setting, you can then incentivize it. And so the next thing would be to prioritize it in some ways, or to set targets, to build that into the templates and the tools, so things that can really change inside of government in a way that allows the allocation of resources to then kind of expand beyond that. And so a good example on the kind of contracting side would be, there's a great example from the city of Chicago. We'll go back to Chicago for you all in around the mid 2010s about the expansion of the Becoming a Man sort of like branded youth mentorship program, right? And so part of to reach this ambitious goal, the city's Department of Family and Support Services, like we're looking at existing contracts that were looking at mentorship. And Becoming a Man was a very well-researched, evidence-based program, really successful in lots of ways at making sure that they were able to stand out. But it is, as you're looking to build it and expand it, it's not just, the city was not just interested in saying, we want to just import this one particular branded program and build it out to do all of our mentorship. No, there are mentorship opportunities, programs that have been in communities for years, right? Making sure that they were serving, in some cases, very small number of kids, in some cases, very large ones. And so as they were looking at undertaking their request for proposals, right, their big contracting vehicle, they wanted to elevate the practices that were identified in the evaluations of the BAM program, the Becoming a Man program, to ensure that all communities were able to benefit from it. So one, they were able to identify, here is what we know helped drive the variation. Here's what we know what works in that. And we're going to require that in this particular vehicle, this contracting request for proposals. But second, if you're not able to get there, right, we don't expect you all to have done a randomized controlled trial and evaluation, or you even necessarily have all these practices. But even if you're not there, we're going to bring you in, and we're going to provide extra value to you as people who really care about it, care about your programs, who have done this great work, to help you move towards where the evidence is, to make sure you're implementing those practices in the systems that you've built that's been specifically housed in communities that trust you and that you've delivered opportunities for. and that let those mentorship opportunities for kids to grow and to expand and take advantage of what works out there in the space. And in doing so, they were able to award 45 community-based organizations new contracts to grow their programming, and allowing that the number of youth receiving high-quality mentorship from going from about 800 to more than 7,000 in 3 years, right? It was data-driven, it was an equitable service delivery model that harnessed the collective strength of existing community-based organizations. So it's like an example here of how this can be done. Its focus started with, let's bake evidence in, let's understand what evidence means here, and let's bake it into the vehicle, let's bake it into the RFP, so that we can bring everybody around the table about what we know we want, what we know works, and then how do we get you all as our partners to help deliver it.
Thank you so much, Zach. So rapid fire, Katie, I'm gonna start with you. So this is the last question for all our panelists. So let's make sure we all get a second in here to give us this one piece of advice that you would give those on this call or on this webinar. How do they use data-driven evidence for decision making?
I think to do an honest assessment of the skill set that you have within your organization, and then the skill sets that you need to bring into your team. When we partnered with SBI, for example, it was a very collaborative partnership where we were, offering different perspectives to the problem at hand, right? They may not be public health experts, but they definitely helped us understand spatially, right, how to visualize the data. And from there, we were able to build a very, very critical foundation for what has become kind of one of the most robust usage of SPI data, I think, in the country. And for us to be able to say, we understand how this works through trial and error with a partner like SPI is really important. Many people think they know data just because they can do a sum, or they can do an average, or they can slice and dice it by zip code. But the truth of it is zip code is too big. It's too big of a geospace to really do any equity work. It's like saying the entire city of Birmingham is the same. You can't say that. There are different neighborhoods that have different characteristics. And so if you don't right now have the capability to analyze neighborhood data, then I would suggest that you pick up a phone and call someone who either has experience or partner with someone who can help you understand the data that you do have and then the data that you need. It's not the same thing.
Thank you. Thank you so much. Coreata, one piece of advice, rapid fire.
Yeah, absolutely. So I just don't be scared of the data. Let the data tell you what it tells you, but it's for progress. So whatever the data is, use it as your base and then make sure that you're committed to making progress on that data.
Thank you so much. Lydia, rapid fire, one last piece of advice.
Yeah, often, particularly in social services, it's a challenge with collecting data takes time and resources, right? And sometimes folks are like, I can either do the work or I can track the work, right? But you can do both, and you need to invest in both. And tracking the work and collecting the data and analyzing the data and spending the time and resources on that is going to pay in spades for being able to dedicate the right resources and the right approach rather than just doing the work. And so invest in the data and the analysis.
Thank you. Laura, one piece of advice, quickly.
Yeah, I would say don't get stuck in analysis paralysis. There's so much data out there that we can collect. So set an endpoint as you are developing those programs. And really bring it back to what our panel has discussed today, which is those lived experiences and that qualitative data as well, to really create the story and understand the people's perspective. That way, your data, your solutions are data oriented but people centered.
I love it. All right, Zach, 30 seconds, one piece of advice.
All right, everybody had a really good answer here. I'll add one more. Find your people. Government is terrible at siloing, right? We all work in our own little fiefdoms here. Find the others that are like you across the organization. It will make your work go faster and better, and you can help solve problems that individually your individual department, agency, or silo were not able to do itself by bringing those various data sets, various evidence places together to solve a sort of fundamental problem for your community.
Thank you so much. I just want to say thank you to all of my wonderful panelists, to our partner organizations, and to everybody who chimed in today to listen to these extraordinary examples of how you can bring data evidence to the granular level and to your people. I think that's the key word today, is to make sure that this is helping your people in your communities and that you understand your uniqueness of your communities. So again, thank you so much. We will be having this video sent out to our people who joined us today. So you'll get a copy of the video. And we really, really appreciate your time. And I want to thank my panelists for helping me make this a wonderful webinar that I believe was very demonstrative of how we can do this work across the country. So thanks everyone for joining us today.